Welcome back to our ongoing series exposing corruption in the health insurance industry. In today's episode, we pull back the curtain on a practice that quietly fuels the system, the revolving door between public office and private industry. When regulators and lawmakers leave government to work for the very companies they once oversaw, it's not just a career change. It's a conflict of interest that affects us all. This revolving door isn't new, but it's more prevalent and more profitable than ever before. Billy Tauzin is perhaps the most infamous example. As a congressman, Tauzin played a key role in crafting the 2003 Medicare Prescription Drug Act, a law that prohibited Medicare from negotiating drug prices with pharmaceutical companies. Within months of the bill's passage, Tauzin left Congress to become the president and CEO of PharMA, the lobbying arm of the pharmaceutical industry, earning millions. Next is Daschle, a former Senate Majority Leader. After leaving office, Daschle became a highly sought-after policy advisor and lobbyist for several health-related organizations. Although he didn't officially register as a lobbyist, he was deeply involved in shaping healthcare policies behind the scenes, earning lucrative fees from the industry. And then there's Marilyn Tavenner. As the former administrator of the Centers for Medicare and Medicaid Services, CMS, she oversaw critical healthcare programs. After leaving government, she became the CEO of America's Health Insurance Plans, AHIP, the most powerful lobbying group for the health insurance industry. Her influence helped maintain policies that protect insurance companies' profits. These aren't isolated cases. In fact, between 2019 and 2023, more than 430 former government officials became lobbyists for the healthcare industry. This revolving door results in billions of dollars spent on lobbying each year. In 2023 alone, the health insurance and pharmaceutical industries spent over $380 million on lobbying efforts. These lobbying efforts have real consequences. Policies that could help consumers, such as allowing Medicare to negotiate drug prices or implementing stricter regulations on denied claims, are often blocked or watered down by lawmakers with ties to the industry. The revolving door makes sure of that. Let's look at the numbers. In 2022, health insurance companies spent over $158 million on lobbying to influence legislation that affects everyday Americans. Bills that could have reformed the healthcare system, such as the Lower Drug Costs Now Act, were blocked by politicians who received significant contributions from these companies. The revolving door isn't just a conflict of interest, it's a betrayal of public trust. When former regulators and lawmakers become paid advocates for the industry they once oversaw, it's the American people who suffer. It's time to break the cycle of corruption. If you have information about unethical practices in the healthcare industry, visit sunlight.org. We provide a secure platform for whistleblowers to expose corruption and hold those in power accountable. Like this video and follow our page for more investigative reports on the healthcare industry.